Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you on my channel Ayurveda Academy. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. Now, I am going to start an interesting serial. Dr. Deshpande is always producing some serials. So, this is a new serial, Ayurveda in General Medical Practice, Ayurveda in GP. The today's topic is regarding the anemia. In Ayurveda, it is called as a Pandu. So, in this series, we are going to tackle nearly 55 conditions which the doctor or the medical students has to face in the general medical practice. The first disease that we are taking is anemia. We will discuss the causes, we will discuss the investigations, and I am going to tell you the different medicines that can be prescribed for the anemic condition. Let us start with the anemia. Anemia is nothing but the low hemoglobin percentage in the human blood. Normal hemoglobin percentage is 12 to 14 gram%. If it is below 10, it is a mild anemia. If it is below 7, that is moderate anemia. If it is less than 5 gram% hemoglobin, then very dangerous. You have to admit the patient because at around 5 gram%, the patient can get a cardiac arrest at any moment. So don't try to treat at home. There you may need some blood transfusion treatment. So this is very clear. Number one. Number two, when to do this type of the investigations, when to suspect. Very simple. Some signs and symptoms I will tell you. For example, here always the old people, senior citizen, always every after year or 6 months, you have to observe the paleness in the conjunctiva. This is called as a palpebral conjunctiva, which should be the pink one. If it is a pale white, then you may suspect that the patient is suffering from anemia. Then always observe the nails. It should be the convex and pink in color, but the nails are totally white. And if they are concave, that is called as a coilynicia, concave nails, spoon-shaped nails, or platinicia, flat nails, that is also indicating anemia. Third thing important is regarding the paleness all over the body. The nails are there, and other things you can observe. For example, the patient will complain totally weakness. Always I am feeling tired, no energy. I cannot go to attend my school. I cannot go to my office. I cannot do my business. So that weakness is indicating that your hemoglobin level may be low. Breathlessness after exertion. If you are climbing the upstairs and if you are like breathless, suspect anemia. If the lady is having a repeated menstrual discharge, heavy discharge, and the ladies have the tendency to keep the secrecy, they don't even mention this particular problem to her husband also, to her mother-in-law also, to her mother also, and that creates a big problem. So excessive menstrual discharge, which is called as a menorrhagia, polymenorrhea, metrorrhagia, all these indicate that the patient definitely must have some anemic condition. So weakness, breathlessness on exertion, tinnitus, sound in the ear, that may suspect that you are suffering from the anemia. Tingling numbness in the hands, tingling numbness, and there is a what you can say, the cold extremity sometimes, that also indicates the anemia. So, and if the patient is suffering from any chronic illness, especially cardiac problem, when the patient is suffering from congestive cardiac failure or chronic renal failure, if the liver problem is there, kidney, liver, heart problem, chronic conditions is there, AIDS, HIV is there, tuberculosis is there, in any chronic condition, I request, please check your hemoglobin, because if your hemoglobin is low, that disease will not be properly cured, or it will not going to the better prognosis. The disease will be like that only, even if you are taking the particular disease tablets, if you are taking the anti-cox treatment for the tuberculosis. But if your anemia and that is hidden, you or your doctor is not knowing about it, if you are not taking any hematinic. What is hematinic? Which medicines which increase your hemoglobin, they are called as hematinic. So this fast introduction is sufficient. Now let us see on the screen etiology, that is the causes. First is hemorrhage, bleeding, either manifest very clear or occult means hidden. Easily you cannot see that particular bleeding, but inside in your body, there may be bleeding is already there. Okay. So manifest where nobody can have to judge, oh, is this bleeding? No, it is there. For example, hematemesis. Blood through the vomiting is called hematemesis. Hemoptysis. In the tuberculosis, blood through the sputum is hemoptysis. Hematuria, blood in the urine because of the urinary stone that can create the anemia. Epistaxis, here bleeding from the nose, especially in the summer season, very hot sun. The children are playing and the breaking of the capillaries over here, it is called as a Little's area, and that is called as epistaxis. Menorrhagia, just now I have mentioned, this is the commonest cause. Don't forget this. So any lady is having the hemoglobin less, you should ask about the menstrual history. And in the gents, you must ask, because in the gents, anemia is very less common. But if the patient is suffering from bleeding piles, hemorrhoids, then he may have the anemia. Melena. Melena is a black colored stool, or with some surgical injuries. If the latest operation has taken place and if there is a little small bleed inside your body, that can create also the anemic condition. Now the occult is like a hidden. In the peptic ulcer, whenever the small bleeding will continue and that will not be easily seen or easily diagnosed. Then carcinoma of the stomach, very important. If there is a chronic low hemoglobin and patient is not improving in spite of ferrous sulfate tablet, Ayurvedic Loha Sava, or so many treatments are given, but there is always drop down of the hemoglobin. Think of cancer of the stomach. Carcinoma means cancer of the stomach, internal piles, ankylostomiasis, that is a type of worm infestation, ruptured ectopic gestation, pregnancy. Remember that. Hemophilia, that is the problem with the clotting factors, hemophilia, and purpura. These are the bleeding disorders because of the less platelet count or less thrombocytes. Then next cause of the anemia is a deficient formation of red blood cell, because in the red blood cells there is hemoglobin. Remember this thing. Red blood cells are like the bags and they carry the hemoglobin, which is a chromoprotein. Colored protein molecules are that. Common when anemia is called pernicious anemia. Okay, that is a B12 deficiency. Iron deficiency anemia. I think especially you must remember this particular. This is the most common anemia in the India. Most common. Iron deficiency anemia. Every pregnant woman is given the ferrous sulfate tablet and also the iron tablets, because iron deficiency, because of the undernourishment in many parts of the India, people are starving. They don't have enough money to purchase the food, low quality food. They are eating the stale food. Beggars are there, slum areas are there, ladies are there because of the repeated pregnancies. So iron deficiency anemia is the most common anemia in the India. Then associated with acute or chronic infections or toxic processes like septicemia, subacute bacterial endocarditis, that is heart related with the heart, acute rheumatic carditis, cardiac heart problem after your joint problem, that is rheumatic carditis, chronic infections, focal sepsis is there in abscess, renal disease, that is kidney disease, tuberculosis is another cause, and carcinomatosis, that is a cancer anywhere in the body. If there is a malignancy, if there is a cancer, you may get the anemic condition. And rare conditions are aplastic anemia, that is the bone marrow, where the RBCs are formed, that bone marrow is deficient. Leukemia is nothing but the blood cancer. Hodgkin disease, scurvy, vitamin C deficiency, bleeding from the gums, scurvy, hemophilia, and malaria. Chronic malaria also can cause the anemic condition. Now, which are the infections where you get the anemia? Low hemoglobin, Clostridium welchi, malignant tertian malaria, poisoning by the certain chemical substances. Morphological types. This is very important. When you get the report of the hemogram, you will get this normocytic, normochromic. This is regarding the RBCs, red blood cells. They are of the normal size and normal color. So then it is anemia? Yes, it can happen in the acute hemorrhagic anemia, hemolytic anemia, and hypoplastic and aplastic bone marrow problem anemias. Next is a macrocytic. The size is big but normochromic. That is because of the deficiency of B12, vitamin B12, folic acid deficiency. Sometimes in aplastic, that is a bone marrow problem and hemolytic anemias. Then macrocytic and the chromatin material, hypochromic, that is a deficiency of vitamin B12, folic acid deficiency, and iron deficiency. Then microcytic, normochromic. The size is small, but coloring is normal, that is in infections. And microcytic hypochromic, I am repeatedly telling you, this is the most common anemia. You must remember this. Iron deficiency anemia, that is microcytic, size will be less, RBCs, red blood cell, and color will be also less. Okay, now which are the investigations? Hemogram, that is you get the hemoglobin, red blood cell, RBCs, WBCs, neutrophil, eosinophil, basophil, lymphocyte, monocyte, platelet count, and the morphology of RBC. So that is hemogram. HB percentage to know the severity of anemia. WBC, total count and differential count to know the possibility of infections. Peripheral blood smear, PBS, to know the morphological type of anemia and to know any evidence of leukemia, blood cancer, because there will be lot of immature cells in the peripheral blood smear. Malaria also, malarial parasites, you can find out its zygote and all these things. Urine routine to see the albumin, sugar, etc. Urea and creatinine in the blood to rule out the urinary tract infection, because pus cells will be there, and also kidney function. Urea and creatinine is mainly for kidney functions. Stool examination, because of the occult blood, hidden. That indicates there is some inside bleeding. When the stool is totally black color and consistently, that 5 days, 1 week, 2 weeks, in the senior citizen, old people, black color stool should make you suspicious that there may be internal bleeding. Black color stool, malina. Then you have to see the ova for the worm infestation, worms, hookworm, threadworm, rockworm. Most common for the anemia is a hookworm. Don't forget that. Cyst, especially to rule out the hookworm infection. Bleeding time and clotting time to rule out any bleeding disorders. Bone marrow examination is needed very rarely if the common causes of anemia are not seen. Now, treatment, how to manage that? Rule out the cause. Ayurveda says, Sanshepataha Kriya Yogo Nidana Parivarya. The first step to treat any disease, to rule out the causes. For example, if you have the piles, treat the piles. If you have the hookworm, give anti-helminthic worm. Infection, treat the infection. Bad habits like the taking a incompatible food, viruddhan, taking the milk and the fruits together, that is not good. Alcohol, lot of consumption, liver will be damaged. Tobacco, malnourishment leads to the deficiency syndrome. Vitamin B12 deficiency, iron deficiency, copper deficiency, etc. Get rid of the cause and supplement with nutritious diet with iron. Okay. Hemolytic anemia or aplastic anemia, that is regarded with the bone marrow, can be due to the chemical cause or side effects of few medicines. So patient may need blood transfusion, get rid of the cause and then treat the patient. If it is any side effect of any modern medicine, see that particular. For example, previously it was a rifampicin that can cause the anemia condition, anti-tubercular drug. Always support your treatment with proper diagnostic procedure, especially in case of anemia, and advise the patient to be regular, as she or he may need to take the treatment for longer duration. Special note, always be focused, because even though the proper treatment, there are following cases which may hamper increase in the blood both qualitatively and quantitatively. Why we are not getting the response? That is, these are the some of the important causes. Patient do not take medicines regularly, either due to the financial problem or merely laziness. That can be problem because hemoglobin level will not increase. There can be blood loss and needs the proper attention. Orally he is taking, but inside their ulcer is bleeding. So no use of these oral medicines. Malignancy of liver or kidney, you should not forget. Check whether it is a cancer anywhere in the body. Lack of quality medicines. not branded, very casual medicines. Other pathology than mere iron deficiency. There may be tuberculosis infection, there may be HIV infection. You have to take care of that infection and then you will get the result. Improper digestion of iron tablets in the body. In general practice, iron deficiency anemia is the most common. Now, some of the interesting prescriptions from Ayurveda. Arogyavardhini, we prescribe one tablet 3 times in a day because this is the best liver tonic. In Navayasa Churna, we have the iron. This powder 500 milligram 3 times in a day with Dadimadi Ghrita. Always remember, Ayurveda says that Ghrita or the medicated ghee is the best treatment as a anupana in treating any anemic condition. Dadima is a pomegranate. Then another prescription. It depends on the various patients. Arogyavardhini, one tablet 3 times in a day. Kasis Bhasma, 100 milligram 2 times in a day. And Rakta Vardhaka is a product from Ayurveda Rasashala, 2 teaspoons 2 times in a day. Another prescription, so many prescriptions Dr. Deshpande is providing. Punarnavadi Gugla, especially when there is anemia because of the hypoproteinemia. Remember this, or liver problem, or kidney problem, because it regenerates the liver cells, it regenerates the kidney cells. Punarnava, Punarnava, Punarnava. And Punarnava is the best diuretic, so edema will be reduced. When the anemia with edema, body swelling, then Punarnavadi Gugulu, then Lohasava, 4 teaspoons with equal amount of water twice in a day. Then next prescription, lot of prescriptions. Tapyadi Lohavati, 2 tablets 3 times in a day. Himol Fort, Sandu Company, 1 tablet 3 times in a day. Suvarna Makshika Bhasma, when there is a general weakness, 300 milligram with sugar and ghee, especially if the patient is having a general weakness and debil, very tired patient. Then for the liver tonic, Kumari, aloe vera. Kumari also number 3, and for children number 1. There is Kumari also number 1 is available for children. Kumari also number 3 for the adult. 4 teaspoons with equal amount of water twice in a day after meals. Next, whenever there is a kidney problem and anemia, use the Chandraprabha. In diabetic patient, use the Chandraprabha tablet. 1 to 2 tablets 3 times in a day. Suvarnamakshikavati, Hari Parshuram Aushadhalaya in Pune, Khadiwale Vaidya, 2 tablets 3 times in a day. Then Goraksa Chinchavaleh, again Hari Parshuram Aushadhalaya. Khadiwale Vaidya is a famous Vaidya, he is my teacher, Hari Parshuram Aushadhalaya, but he is now, son is there and the pharmacy is there, medicines are there in Pune only, in Pune. Khadiwale Vaidya, Hari Parshuram Aushadhalaya. Okay, you can search on the Google also. Then Goraksha Chinchavalaya, specific medicine for anemia by Khadiwale Vaidya, 2 teaspoons twice in a day. Then Manol malt. Manol malt is also one of the very interesting formulation, that is 2 teaspoons twice in a day. Okay. Next prescription, how many? Nearly 10 prescription. Saptamruta Loha, especially when there is a tinnitus. Saptamruta Loha is the best. 2 tablets 3 times in a day. Lohin, Ayurveda Arkashala Satara. All the important companies I have taken the medicine. Lohin, 2 tablets 3 times in a day. And Rakta Jivana, Ayurveda Seva Sangha Nashik, ASS, Ayurveda Seva Sangha Nashik, Maharashtra. 2 to 4 teaspoons 2 times in a day. Next prescription, come on. Mandura Bhasma, Ayurveda Seva Sangha Nashik, 100 to 500 milligram 3 times in a day with ghee and honey. Mandura Bhasma is the best for the children. Anemia in the children with worm infestation, Mandura Bhasma. Then Loha Bhasma, 100 milligram 3 times in a day. Always give with the ghee and honey, but ghee and honey should not be taken in an equal amount. Ghee is more 1 spoon and honey is little bit 1/4 spoon only. Then there is a Pradharantaka Loha, especially for the ladies. This formulation is for ladies. Whenever there is excessive menstrual discharge or leukorrhea or cervical erosion, then Pradharantaka Loha, 200 to 500 milligram 3 times in a day with milk or rice water you can give. Then Triphala Mandura, 1 tablet 3 times in a day with Lohaso, 4 teaspoons with equal amount of water twice in a day after meals. N number of prescriptions Dr. Deshpande is providing to you. Punarnavadi Mandur, again with the swelling in the body, and for the ladies, 2 tablets 3 times in a day. Suvarnamakshika Bhasma, 1 tablet 3 times in a day. Abhraka Bhasma, especially when there is a psychological problem, tuberculosis disease is there, cavity is there, and brain is little bit not working well. Abrak Bhasma is good. 1 tablet stress, mental stress and anemia together. Abrak Bhasma is best. 1 tablet 3 times in a day. Vanga Bhasma, if there is a problem with the reproductive system, infertility is there and anemia is there, Vanga Bhasma is the best. 1 tablet 3 times in a day. These Bhasma tablets or capsules are also available of Arya Vaidya Shala Kottakal. Search on the Google. Arya Vaidya Shala Kottakal. Bhasma capsules are available. Okay. Chavanaprash, all-time Rasayana, best tonic in Ayurveda for all tissues. Rasa Rakta Mouse made. 1 teaspoon with 2 times in a day, especially also useful in the tuberculosis patients with anemia. Then Bola Baddha Rasa, typical medicine for bleeding piles. Best medicine, Bola Baddha Rasa. Immediate piles bleeding will be stopped. 2 tablets 3 times in a day. Kama Dudha, anti-pitta drug. Whenever there is acidity or bleeding piles, anywhere bleeding, hemophilia, then ITP, Kama Dudha Rasa is the best. Pravala Bhasmavati is also best because they are best Pitta Shamaka. 1 tablet 3 times in a day. Lohaso, 4 teaspoons with equal amount of water. Next is a Navayasa Mandur, 2 tablets 3 times in a day. Bilva Magaja, that is pulp of the fruit. This is not easily available, but this is the best medicine whenever there is a recurrence. That means every after 2 months, the hemoglobin is dropped. Every after 2 months, hemoglobin is dropped. And you want that there should not be recurrence or following or normal routine treatment is not working well, then always try to use. This is from my guru, Vaidya, late, LATE, Vaidya Yogodoshi sir. They have taught us that Bilva Magaja is the best medicine for the chronic type of anemia. 250 milligram 2 times in a day with Dhatri Avaleha. Regimen, plenty of green leafy vegetables because it is having a good amount of iron. Then carrots, vitamin A and iron, amala, pomegranate, apple, nachni sattva, best nachni ragi, RAGI. Nachni sattva, porridge you can take, figs and the dates. Healthy mind for healthy body. To avoid, these things should be avoided. Hot, pitta prakopit ahar vihar, rakta dushtikar ahar vihar. Food and lifestyle will disturb the pitta, which will disturb the blood, should not be taken. So hot, pungent, astringent, spicy food should not be taken. Over stress, mental stress, workload, working with the fire, exposure to the sun should not be allowed. Smoking, alcohol, tobacco, no. Sleepless nights and overindulgence in sex, that can be the problem to treat the anemic patient. So my dear friends, today Dr. Deshpande, Professor Deshpande has discussed Ayurveda in GP regarding the anemia, causes, investigation, and also the treatment. So my dear friends, please subscribe my YouTube channel. Also share this video to your friends, and we will see in the next video, Ayurveda in GP, next topic. Thank you very much. Take care. Once again, thank you very much.